I was playing basketball at Balboa Park, and after the second game, I sat down for a second and basically passed out. At that point, apparently, I had a heart attack. There was a passerby who happened to be a doctor who started doing CPR on me. Robert Finefield. And he kind of kept me going until the paramedics got there, and then the paramedics kept me going. And as they were transporting me out of the parking lot, I revived. Which gave them the opportunity to take me to Tarzana Medical Center, where they had a cath lab, where Dr. Ben-Zur was waiting. And at that point, you know, he did his procedures. He did an angiogram, an angioplasty. He opened up two arteries leading to my heart, put in a couple of stents, and 3 days later, I was out of the hospital. And 5 days later, I was walking around. And basically a week to the day after after I had the heart attack, I walked from my house, which is about a mile and a half away, to the park where all my friends, all my basketball buddies were, and I just got like this rousing ovation. It was amazing. I just kind of walked down there, and they just started, "Howie, yeah!" They started clapping and thanks.
So I got called by the emergency room physician that there was a young man down at a basketball court, and he had a sudden death episode. He was coming by paramedics, very, very sick, in shock, with a rapid heartbeat, and bad EKG changes, and everything looked like something very bad was going on. I got the call while the paramedics were still en route, and I drove very, very fast to the hospital.
Which is your habit.
And got there before the paramedics, and set up the catheterization laboratory and got everything ready so that when he did arrive, everything was ready. And those few minutes, I believe, really made a big, big difference. Paramedics brought him right into the catheterization laboratory. We started operating on him right away. As soon as we opened up his artery, he said that the chest pain that he was having cleared up. And then within a half hour, he was able to communicate, and slowly, after a few days, the first few days, he didn't have his memory. He didn't remember all the events, and had lost some short-term memory, which meant to us that he was down for a little while. And had he been down for any longer, probably would have not done very well from a neurologic standpoint, from a brain standpoint. And from a heart standpoint, there's no evidence of any damage on any testing that we've done. So he's really as normal as he can be from a heart standpoint. He's got excellent exercise tolerance, and he's able to run. We open the office very early in the morning, and I typically see him from the window as he's running down Ventura Boulevard at full speed. It's very remarkable. He's in great shape.
You told me that his young wife and children were very much part of the equation for you. Tell us about that.
I knew that he was a young patient, that he was active, and that he had a young family. I grew up with a dad who lost his father at a very young age in a hospital. And that made a tremendous mark in my life. And just, my dad still cries till today that he lost his dad when he was a young child. And because you know that if the person suffers a bad event, a lot of people really have have a dramatic change in their life. And I think that, like I said before, I think my heart was beating faster than his heart sometimes. And it was just so gratifying to bring him back to his family that those are always some of the best times in my life. Just, you don't express that to the patient a lot of times, but inside you see them getting back together and you say, wow, you know, I wish I could have done that for my dad.
Victims of good medicine.
I have to thank you.